Hey guys, welcome to the podcast. My guest today is Maja Beilmann-Schramm. She's an MSL Excellence Leader, and we talk about how global MSLs and US MSLs can learn from each other and what they can do to improve. So it's a great conversation. I really think you guys are going to love Maja's perspective. Don't forget to follow me on LinkedIn. Check us out on MSL Talk Live, which is a live discussion just like this, but it's on LinkedIn Live the first Tuesday of every month, typically at 1:30 p.m. Eastern Time. Welcome to MSL Talk with Tom Caravela, a podcast specifically designed for MSLs and all things field medical. Hey, Maja, welcome to the podcast. Thanks for joining me.
Hi, Tom. I'm glad to be here today.
Yeah, I'm really excited. So we got a really awesome topic that we're going to discuss. And, we don't always venture into the global conversations, but we do have a global audience. This podcast has listeners in right now 88 different countries, and there's a lot of folks listening in Europe. So let's do the global conversation, but it's not just global because a lot of this is going to pertain to all of our listeners in the US as well. We're going to kind of talk about some nuances and differences and similarities and what we can all do together. So this could be a really unique conversation. Before we do that, why don't you do a quick intro and tell everybody who you are and where you're from and all that good stuff?
Absolutely. So my name is Maja Beilmann-Schramm, and I'm currently in a global role at Merck, which in the US would be EMD Serono, just to be sure everyone knows where to place me. And this global role is called Field Excellence and HCP Exchange. So it tells you I'm responsible for our exchange communication to the HCPs. However, I want to give you some background because I think it explains where I'm coming from and how I know the global perspective. And actually, when I started like 23 years ago in pharma, I started in sales and marketing. So it helps me to put into perspective some of what we do with the MSLs, right? But for more than 13 years now, I'm working and focusing completely on a Medical Science Liaisons role. And I've been an MSL, I've been leading an international team, so mainly Europe and Canada. I've been in a global MSL lead role, national MSL real team role, and now in the global role. And this is how I'm getting to know all these countries. So, of course, because I've been working very closely with Europe, I have a lot of expertise in Europe. And Canada, interestingly, is often lumped into Europe. So it's in between the way that the US works and Europe works. Very interesting country, just as a side remark. But now I have the global perspective and I keep learning ever more, what is different in the country. So I'm actually very excited we're going to speak about this because we don't hear about this often. So let's go.
Let's go. Let's talk about some global stuff and some US stuff. Before we do that, I do have to announce that this episode is sponsored by the Aspire MSL coaching and training program. Some of you may know Sarah Snyder, one of the recruiters on my team, awesome recruiter and prior MSL, and I started a coaching program for MSL or aspiring MSLs that are looking to break into their first role. So if you want more information on how to join our coaching program, go to mslmastery.com and learn about the Aspire MSL program. So, Maja, let's talk about, and let's start with what are the differences between global MSLs and US MSLs. So, for example, MSLs in Europe, like what are the differences with MSLs in the US?
So one of the first things that actually I was made aware of is that the teams in the US usually have smaller target HCP groups, or vice versa. In Europe, you have bigger groups. You can easily have a target group of 80 or 100 physicians, which is a lot, versus the US, where you usually be around like 40 maybe. Some have even smaller target groups. So that changes the way you're working. And also, in Europe, it's often smaller teams, but that's just simply due to the smaller size of the countries, I would say. And then another aspect is that in Europe, you find, or Greater Europe, you find that the topics you're discussing, or there's a broader range of topics you're discussing. You're going broader. Versus in North America, I find it more focused, very, very strategic, and very close to the current strategy and topics that the team are as a whole investigating. So this is some differences, and maybe one more, because I'm finding that very interesting when it comes to career steps. That is that in Europe, the MSL is an entrance into the pharma company or the pharmaceutical industry as such, and it can be in the US as well. However, the MSL team lead in Europe is just a stepping stone. It's so hard to find an experienced MSL lead because they do this once to learn leadership and then they move on. And in the US, you actually find experienced MSL leaders, and this is exciting, and you cannot find them in Europe. So that's a completely different thing. It may be the salary is so much better as an MSL leader in US that people are happy. I don't know exactly what it is, but it makes a big difference when you think about career.
Yeah. Well, it also opens up opportunities for folks in the US that may want to take their show on the road and apply to positions overseas. I mean, what you just said in the first 5 minutes of this conversation is new to me. That's not something that I'm aware of, that I've heard of before. So I think that is, I mean, it's pretty groundbreaking. It's interesting. And it's novel because I haven't heard it. I definitely have not heard that before on this podcast. So we're off to a great start. So then as we look at some of the differences, but what about, like, let's talk about the role and the responsibilities. Like, what types of things might be different when we compare the two, global, Europe versus US?
Yeah, so the role in Europe is a bit broader versus the US. So, for example, when you think about speaking to payers or researchers, and what I find in the US is often you would rather build a new team. So, for example, EMD has an outcomes team. It's a field team. In Europe, you wouldn't do this. You would connect with these people. They might give you a task, like say market access needs information. They speak to the MSL, they get a task, but they have to fill this, whatever they are being asked of. Versus in the US, you have like a smaller corridor of responsibilities. And this leads to many other aspects. So, and in addition, and it's not because of that, well, partially, but in addition, the topics are broader that we discuss in Europe. And this comes more from the history. So the role of the MSL is newer in Europe than it's in the US. And when we started with MSLs, oftentimes, and especially at Merck, we have been employing MSLs for like, I don't know, really a long time, longer than many other companies. And in the beginning, it was often more a scientific discussion role, yes, but it was open what you're discussing. And they were often having a budget and supporting physicians with studies of interest, but from a physician's perspective, interest of the physician. And this gives you a broader responsibility. I think that's where it's coming from. And it's still broader. Versus in the US, I'm finding it more focused. I'm finding it more, actually a bit more structured and strategic. So I'm remembering this the first time I'm being in North America at a Congress. And after half of the day, the MSL lead brings the team in and says, guys, what we're communicating here doesn't work. We're going to change our communication and we do A, B, C. I've never seen that in Europe. Not going to happen. They give you the topic. This is what we want to discuss. And then they leave it to the MSL.
That seems like it's got to be challenging from the perspective of tracking KPIs and metrics, because in the US, when you're more strategic, I would think it'd be a little easier to implement a metric system and program for people to follow. But if it's broader, how do you track it? What happens on that side of it?
Yeah, so there comes the challenge. Overall, we're sharing the same metrics in terms of, number of visits or field days or, things like this. And if they're useful or not, or effective or not, that's another topic, right?
Yeah.
But it's very similar. However, I would say overall, we have a little bit more project-focused objectives in Europe. So, for example, Spain is very big on educational aspects. So they rather track educational meetings or other more qualitative parts, maybe support on research, these kind of things. But overall, we're all having the same discussions. And I can see how we can sometimes differentiate between a individual metric. I do want to know when the MSL is in the field and how often and how many people they speak to. But in the end, to me, it's more important that we're reaching the results and the goals that we've said we want to reach in the beginning. And the current metrics that we often use, like number of contacts and such, does not necessarily help me in this regard.
Yeah. Interesting. So there's definitely a lot of differences, but there are some similarities as well. So like, what do you think we can learn from each other?
Yeah. And I think it's to me, it's exactly this aspect of being broad or narrow. I think from the US perspective, I sometimes wish the colleagues would be more or being closer to their colleagues from other teams. Okay. So like an outcome liaison or the publication team or, teams that are working in medical affairs, not only when there is an internal meeting that is structured, but also just this openness to understand what they are doing, what their plans are, what their discussion points are. That will help in the way that you're speaking to the physician, because you know exactly what the other teams are speaking about with the same physician in the end. And it will also help our more omni-channel focused future self, because we have to understand what else is happening in order to be most productive and effective in meeting with the physician. So from the US perspective, that's what I would love to see. It's a bit more, broader perspective on the HCP communication. From the European colleagues, I'd rather see a more strategic and a bit more, not going to say narrow approach, but more strategic. So what exactly do we want to communicate? What exactly do we want to learn from the physicians? Versus just going in and having this meeting and like, yeah, I'm going to discuss X, Y, Z. Well, make sure that X, Y, Z fits with the strategy. And it's not something that you are interested in or the physician is interested in. And you can add this, of course, anytime, but keep track of you delivering what the company expects.
Got you. So you mentioned omnichannel, which is a big buzzword right now, as you know, and as everybody listening right now, shouldn't probably be the first time you've heard that term. As a matter of fact, we had an episode recently about omnichannel engagement. So let's talk about that just for a second. Is that a European thing? Is that a global thing? Is that a US thing? Like where did, what's your perspective of omnichannel?
It's definitely a global thing. It's just happened because we all had to move to more digital ways. Well, that's not the reason, but it just, it happened way quicker and faster than we anticipated. And I think it's a global theme. And often when we think omnichannel, we're thinking about a lot of digital tools and virtual platforms. But in the end, what it means is that we are communicating with our physicians in a seamless way. Mm-hmm. So every interaction should be informing the next communication, or vice versa. Every communication I'm anticipating should be informed by what's happened in the past. But that means, from a physician perspective, we are one company, so we have to work closer together across teams to be aware what else is happening. And that's why I'm saying to have this broader perspective and also interest in what our colleagues are doing. This will help us in this omnichannel approach and the communication the physicians are expecting from us in any part of this world. Yeah.
It's such an interesting concept and it's such a big topic. So if there's anyone listening to this that isn't 100% comfortable with what omnichannel is, you should definitely check it out. I learned a lot from my podcast with Donnie Wooten a couple of months ago, I want to say now. So yeah, definitely check that out. So where do you see areas for growth? Maybe this is a two-part question. Where do you see areas of growth for US MSLs, and where do you see areas of growth for European MSLs? Or is it the same thing?
I was going to say, I think currently in the environment we are in, it's very similar. I think we have to learn or keep up with the changing environment, and omnichannel is a big part of it. I can see basically every company where I'm talking to colleagues on a regional or global level, they're all working across this topic, and it expects from us that we maybe plan better ahead of what we're doing, receive more information from all the other colleagues communicating with the physician, and learning from each other. And let me speak about this for a moment. because I heard, and I'm finding this interesting. So I heard from a country team that they cannot do omnichannel because the field team is too old. What?
What's that to do with anything?
Yeah, exactly. And like, what? Okay, so that's not the idea.
Right.
Doesn't mean digitalization or digital MSL only. It just means, seamless communication. Okay. So then the answer to their issue was, well, we're going to rejuvenate the team. And I'm like, oh my God, does that mean you're just hiring like 20-year-old colleagues? No, that's not a good idea. So what I think, and where people can grow and the team leads are a bit challenged in is we have to bring all of this together. We have to bring in the experience from our MSLs that have been in the field way longer. They actually know how to get access to a physician in a clinic. I mean, physically actually walking into a clinic, getting access, versus the digital affinity and ability of the younger colleagues who can easily navigate all these, social media tools and all this stuff. And we have to bring this all together. We have to learn and we have to grow ourselves so that we can actually show up towards the physician in a way they expect us to communicate, like as one from a company, but also what they see outside of our communication, their private life. They're really getting used to this easy access of information, 24/7 information, self-service idea. And I feel like when we develop now, we have to grow into a sweet spot, so to say, where we can navigate this and deliver this to our physicians.
Well, I think a couple of things to unpack there. First of all, I agree, or I think that it should be said that you certainly can teach an old dog new tricks. For any of those that are looking to oust all the old folks, that's me speaking because I'm an old dog and I'm trying to learn some new tricks myself. I think we all have to evolve. I think it's a responsibility for the organization to have a strong enough training program and leadership to be able to bring their teams to the next level, whether that means omnichannel, artificial intelligence, whatever, being strategic, whatever that might mean. So I do agree and believe that there is a need for evolution, especially now, because things are moving so fast. But I'm gonna get back to that word strategic, because that has come up a couple of times in this conversation. And you and I spoke about how important it is for MSLs to be strategic. So can you talk about that a little bit? Because I know that that's a big topic for you.
Yeah, it's true. It is. And maybe just because I wish to see more of this. Strategic to me means plan ahead and know what you're doing. So usually we have a brand plan in a company, and part of this, or a separate medical plan. So you have a medical plan for medical affairs in place. And what I see too often is that what the MSL do in the field can be not connected, actually disconnected to this medical plan. And strategy to me means I have put a lot of thinking and effort into developing a plan because I understand the patient pathway, I understand physicians' needs, I understand my product, I understand my pipeline. So there's a lot of planning going into this, and there are some aspects that I want to achieve, some goals I have as a medical affairs team. And we should be breaking down the medical affairs plan into an MSL plan. So what of this plan can be fulfilled by the MSL team? And from there, and you can discuss this as a team, some things are better done by an office-based team, some things are better done by a field team. And this will also determine your key KPIs, key performance indicators. You have a goal, you're going to work towards the goal, and you want to make sure that you're achieving your goal. And that also, so I'm coming back to my planning, and I'm actually not the person's planning. And so I used to be the person of, I'm going there. I have kind of an idea what I'm talking about. Yeah, that you can do that, but you're not going to be as successful or effective. So once you know exactly what the goal is, what the MSL plan is, what the field plan is, you break it down for yourself, for your physicians, and make sure that you're not holding whatever, an educational meeting just for the sake of holding a meeting. You want to know who should be attending this meeting, who needs to hear the information. if they are missing this meeting, but I want them to hear the information, how else can they get the information? So basically, I'm following up my physician's path so that by the end of the year, whatever your planning period is, I make sure that they've heard exactly what I think or know they want to be hearing or need to be hearing in terms of education or whatever other information, versus saying, I'm holding 5 educational meetings, yay, and I do this and I just check it off. And then at the end of the year, I'm realizing that important physicians, especially when you think about launch preparation or and rather new product in the market, I'm realizing they have not received the information they need to know in order to treat their patients appropriately or speak to a treatment to their colleagues.
And where do you think the responsibility lies for this strategic need? Is it the responsibility of the MSL? Is it the responsibility of the organization, the leadership? Like, where does this start and where does it end?
From my experience, the most successful is if it starts with the medical director or the TA lead, because they usually have the medical plan in hand, right? And if they speak to the MSL lead and how to break this down for the MSL team, or what parts of this plan can be fulfilled by the MSL team, I think that's a good way forward. And then the MSL team lead breaks it down to the individuals. And well, some of this they have to do themselves. So the more, and also how, depending on how you set your metrics, this for anyone, the way that you that your objectives are set up or your metrics are set up, this is what you're going to do, right? You follow your objectives, basically.
Yeah. And it ultimately comes down to the MSL is responsible ultimately to carry it out, whether it starts from the medical director, it starts from leadership, whatever. I think what the difference between top performing MSLs is their ability to carry out the plan and to cross every T, dot every I, and make sure that they're moving the needle the way that they need to for their territory, and carrying out that strategic, whatever the strategic initiative and whatever that goal is. So you also said and talked about the importance of involving others. So I want you to explain what that means, and if there are differences. Again, since we're having this discussion, global versus US, so to speak, is it different in different areas of the world, or does everybody need to have the same philosophy when it comes to involving others?
I would say different philosophy. I don't think there's a different philosophy. It might often depend a bit more on your team size. Well, actually, no, there is a different philosophy. Okay, so let me give you an example. One example that I really liked in terms of involving others, and this was going even beyond the country team. So at one point, we were preparing a launch, and we had to approach physicians that we hadn't been working with in the past. So we needed access to physicians, and we had this list of physicians that we felt we really need to speak to, and not everyone was open to speaking to us, it's a normal situation that happens, right? So after our planning, we were left with a list of, I think it was like 8 physicians that was super important, but did not want to speak to us, or we didn't have access, right? So what we did, we looked at all of those physicians and were wondering, from what we know, what would make them interested in speaking to us. So there was one physician who was publishing a lot. So we were thinking, okay, maybe we can get our publications team. And this country that I'm speaking about was a medium-sized country, so they didn't have their own publications team. So we were reaching out to the global publications team and saying, hey, we have this physician, this is the experience. Is there any way you can involve this physician? Or something similar with someone who was very big in studies. And if I remember correctly, out of those 8 physicians, for 6 of them, we found a way to work with them, project-based, right? But this is a mindset, and it's work. It's work. You're reaching out to others you might not even know internally. And I've seen this happening more in Europe or in Japan, for example, versus the US. On the other hand, US teams are generally bigger. I guess you have internally in your country, you have enough people to reach out to. You have a publication team, you have big study teams. But this is something that I would always recommend if you're having, or if you, coming across access issues, to see who else, of course, might be in contact with the physician, but could also be benefiting from having contact to the physician on both ends, for the physician, but also from the company perspective.
I mean, it makes total sense. Being collaborative and sharing information, sharing knowledge has to help. Whether it's US or global, it has to help. If you know more about the physician and their practice, their needs, likes, dislikes, and what the hot buttons are, it can only help. Whether you're talking about the MSL versus the commercial counterparts or whoever else might be involved, right? So when you do, in your experience, when you look at the whole access issue, is it any more difficult in the US versus Europe, for example?
That is a very good question. Awesome. I didn't think about this. So yes, there are countries who have way more issues with access. For example, the Nordics, like Finland, Sweden, very restricted access. They allow, like one company person per quarter to access the clinic. Well, that's not a lot. You have to be very creative to find ways of providing value, having them invite you. So that's it's very open in terms of access, right? You know exactly what the rule is, but you have to be smart enough to find your way in, basically. I think that is a huge difference. I've seen physicians in the US, they accept everyone. And I'm like, and they're overwhelmed by the people talking to them from a company, where I was wondering and sometimes asking, so why do you allow everyone in your office? It's still your office, So there is a difference. I find the US physicians very open. I have to say, in general, I find physicians very open, but some countries have more restrictions as a country, as a rule. And then, of course, there's some clinics who are very strict and some physicians who just don't want to talk to us.
That's interesting. And I think that puts into perspective for a lot of MSLs that are in the US listening to this that are having access issues. I think it's really important to know that it could be worse.
Oh, yeah.
Right? It could always be worse. So what can you tell those folks? Or do you have any tips, tricks? What can US MSLs learn to help with access that maybe folks in other areas of the world are, best practices that they might be used to that are helping them with access?
It's really about being very individual with the individual physician or clinic. Mm-hmm. So understanding what they are interested in and taking this into consideration as a starting point, maybe more of what we are interested in. And again, seeing who else has access. Sometimes it can be even another company that not necessarily have a competitive product, but might be in the same area that can help you with access. And then try to approach a physician outside of the clinic. Congresses, as you know, is awesome. And it's actually sometimes funny to watch some company representatives waiting for a physician, to talk to them. But this is a way to do it and be as casual as you can. And just even speaking at the coffee bar to someone that you don't know, sometimes, just saying sometimes, right, can lead to an awesome connection to a physician. One thing, speaking about Congress, that comes to mind that was a very successful move from one of our team members was sitting next to the physician at a Congress in the audience. I think it was almost more like an accident, but because, you're sitting next to each other, you just start doing some small talk, and that was an awesome connection. I guess what I'm saying is find these moments where you can have easy access. You don't have to go there and right away, introduce yourself, and this is me, this is my job. But sometimes it's more a relaxed environment. Of course, adhere to your company rules and regulations, and all this and the compliance things around this. But I think being creative, proving value, being clear on what you communicate, and also if you get this one-time chance, you want to have your 2-3 sentences ready that you want to speak to the physician, that they know how you can bring them value.
Yeah. Well, it's funny, and you could accidentally, on purpose, just wind up sitting down next to a KOL that you've been wanting to see. And I had done a podcast with Andrea Johnson a while back, and she had a term. It was like tactful stalker or tactful stalking or something, where it's like the strategic stalking initiative, where she would, try to find her KOLs outside of the office, whether it's at conferences or, on their way to the coffee shop, get to know their practice, their habits, where they're going to be, and know what they look like, know who they are, and just kind of wind up being in the same place at the same time. And she talked about, again, it was like term like tactful stalker. But I think that creativity is a big thing, and putting yourself out there and showing up makes a big difference. And I know a lot of people don't feel comfortable doing that, so I totally get it. And there's always the compliance issues, and some companies are maybe a little different about that. But I love that idea, and I think that is something that really successful, top-performing MSLs get really good at. So as we close up, what other kind of final words of advice do you have for MSLs, whether it's US, global, as you look into the future and where things are going? What might you tell people?
I think what we currently all need is flexibility and openness to what's there to come. This is like, it's changing for some more than for others, but currently, if I'm hiring someone, I really be looking for flexibility and the openness to learn something new, as we discussed earlier, and embrace your role. And by the way, that helps when you're saying not feeling comfortable, and embrace your role. Think about your role, what the company expects of this role, and then really embrace it and live it. And that I'm finding it makes it easier, even with those parts of the role that you're not so comfortable with.
Embrace your role and live it. I love it. That's awesome. That's a great way to end it too. There were so many quotable moments. I was like taking notes. I have a lot of stuff that we can quote from this episode. So thank you, Maja. I appreciate you. I appreciate you coming on.
Thank you for having me. It's an honor. I mean, everyone's listening to your podcast. I'm listening, by the way. So it's an honor to be here. It was really, really wonderful. Thank you for the opportunity.
Thank you for saying that. It means a lot. And thank you out there, everyone that listens to this show every week and makes it what it is. I really appreciate you all. And I will see you next time. Thanks, Maja. Thanks, everyone. Thank you so much for listening to the show. And if you enjoyed it, please subscribe so that you don't miss an episode in the future. And feel free to leave a rating or a review or a comment. Thanks again, and we look forward to seeing you soon.